Welcome, everybody. Welcome to another episode of PEM Rules, the Pediatric Emergency Medicine podcast. I'm your host, Yaron Ivan, as usual, and today I'd like to discuss some more important rules. Rule number 150. Pull your team. Let the team have ownership while you guide them. I'd like to give the credit for this rule to Dr. Todd Zimmerman, who is a pediatric emergency physician at Sunrise Children's Hospital in Las Vegas, Nevada. And this rule is all about being a good leader. Therefore, I'd like to quote some other rules of mine from previous episodes that really have to do with being a good leader and having good leadership skills. Rule number 37. Complaining is like vomiting. It makes you feel a little better. It makes everybody around you feel a lot worse. Leaders don't complain. Rule number 50. When you become a leader, it is no longer about your success. It is about the success of those around you. And rule number 150 is actually very similar to rule number 50. When you become a leader, it's really about letting your team do their thing, giving them independence while you push them and encourage them to be independent. I like this rule because it's like a metaphor. You, as the experienced leader, should be at the head, leading, but should lead by example and pull the team or teach them to do what you do and how you do it. Let them have ownership of their patients, let them hold themselves to high standards, let them be independent and practice their own way while you lead them and show them the way. On the same note, pull your team. Let the team have ownership while you guide them. Hire good people you trust, and let them excel in what you hired them for. Let them do the work they do their way while you lead them and give them the independence to do it. I think this is a great rule that is probably easier said than done. Very often, as leaders, we want to do it ourselves, to do it our way. But as a leader, it's also important to step away and let the team do their thing while you're just showing them the way you do it, but really give them the independence to be on their own. Rule number 151. Know what to look for. This rule really has to do with being a pediatrician or a pediatric provider and realizing that what you're seeing in front of you or the etiology for what you're seeing in front of you is really age dependent. Like many things in pediatrics, everything depends on the age. So if you're seeing a patient with chest pain, you got to know what is the most common cause of chest pain in a child this age, etc. A good example is knowing what is the most common cause of a surgical abdomen by age. So this has happened to me actually several times before in the 6 or 7 years I've been attending. I walk into a room of a child with a GI complaint, let's say vomiting and abdominal pain, very common, and after getting the history and doing my physical exam, I'm quite impressed and I truly believe the child has a surgical abdomen. The history is concerning, the exam indicates maybe peritoneal signs or rebound, etc. At that point, I, as a specifically pediatric provider, have to know what to look for. It makes very little sense to work up a 2-year-old for appendicitis, since appendicitis is extremely unlikely and extremely rare in that age. Likely, a patient with a surgical abdomen who's 1.5 years or 2 years old has intussusception. So I, as a pediatric provider, must know the epidemiology and the most common cause of X in a patient that age. On a similar note, if I see a newborn with what I think is a surgical abdomen, a patient that is about 1 week or 2 old, I need to know that the most common cause of a surgical abdomen in that age is probably malrotation with volvulus, which has a very specific workup. So again, know what to look for. Know the etiology and the epidemiology of pediatrics, which is fairly basic to know, and know what to look for based on the patient chief complaint and age. This is essentially a rule that we do all the time, specifically with infectious processes. When we see a pediatric patient with pneumonia, based on the age, we often think about the most common cause of pneumonia in that age, maybe even not realizing it and giving the appropriate antibiotics. So when a 7-year-old comes in with cough, hypoxia, fever, I got a chest x-ray and I see that there's pneumonia, we all know that the most common cause of pneumonia in that age is strep pneumo, that is usually sensitive to ampicillin or amoxicillin, and we prescribe the appropriate antibiotics. We know the most common cause of pneumonia in that age. This rule is essentially no different. We as pediatric providers have to know the most common cause of the chief complaint by age. Another good example for this rule is the patient that comes in with chest pain, let's say a 7 or an 8-year-old with significant chest pain that is very impressive. Likely you're going to get an EKG, but one has to know that MI in that age in a normal healthy kid will be extremely unlikely. You better look for signs of myocarditis or pericarditis with diffuse ST elevation, for example, as opposed to ST elevation in a specific lead indicating an MI. Myocarditis or pericarditis, although not very common, will be significantly more common than an MI in a normal healthy child. Rule number 152. Every case is a learning case. I learned this from Dr. Michael Mujica, who is a pediatric emergency provider in New York, an astute physician and an astute teacher, who I actually had the honor of having on my podcast. I encourage you to listen to episode number 70, where we discussed teaching in the pediatric emergency medicine field. Not surprisingly, Michael, who was a pediatric emergency medicine fellowship director and has been teaching pediatric emergency medicine for many years, has that rule. And I couldn't agree more. Every case is a learning case. I have to say, my personal experience is that this rule is easier to apply when you have trainees with you. I often find myself discovering something new while teaching the residents and the fellow. Something about listening to another presentation triggers something in my mind and oftentimes leads to a good discussion and maybe a literature search and allows you to learn something new every time. I think my favorite example for this rule is my own experience in residency. So in my residency, like all other residencies, every resident had to give 1 or 2 or 3 talks about a topic of his choice every year. And I remember in intern year thinking about what am I going to give my lecture on. I came across an article in Pediatrics in Review, a great journal for the general pediatrician, named The Common Cold and Decongestant Therapy. Reading the title, I didn't think much of it. What is there to know about the common cold? This is a benign viral illness that we see all the time. Nothing really works. There's really no therapy. But as I dove into the article and read more of it, I realized there's so much research and so much to know about this benign viral illness that we diagnose all the time and think nothing of it. There are research studies, there are publications indicating what treatment is more effective than others, and essentially it can be a PhD in and of its own. Who would have thought? That made me realize that really every case is a learning case. Even a patient that stands in front of you with what seems to be a benign viral illness, there's always a lot to know and a lot to learn from every case you're seeing. Over the years, I put together a lecture based on that article, The Common Cold and Decongestant Therapy. I will put the link in the show notes for you. I highly recommend this article to read by any provider who takes care of kids. Benign URI is what we see all the time, and there's actually a lot of research behind it, and there's a lot of evidence in what treatments work, what treatments do not work, and what we as pediatric providers should avoid. I hope you enjoy the article. It's actually quite a few years old. And that is it for today. Thank you very much for listening to PEM Rules. Let's review briefly what we learned. Rule number 150. Pull your team. Let the team have ownership while you guide them. Rule number 151. Know what to look for. Know the basic epidemiology of the chief complaint you're seeing in front of you. Rule number 152. Every case is a learning case. Remember, there's always something to learn from every patient you're seeing, whether it's medical or just maybe approach to the patient or maybe a skill of how to talk to the parent. There's always something to learn. I hope you enjoyed the episode. I hope you continue to listen to PEM Rules and check out my articles on EP Monthly. The following outro is one of my favorite songs by the Beastie Boys. It's called No Sleep Till Brooklyn. Hope you enjoy it. Have a great day.